So the next presentation, plasmonic structures for signal enhancement in medical diagnostics, will be given by Magdalena Šimke, a business developer at Stratec Consumables. So Magdalena, please, the floor is yours.
Can you see my screen?
Not yet.
Okay.
Yes. Now we see your presentation.
Does it work now?
Now in presentation mode. Perfect.
Perfect. Thanks a lot. So thank you for giving Stratec the opportunity to speak here. And I think the topic I am going to discuss is probably a bit different to the two previous ones, but I hope it's still interesting for you guys to hear about how we, what our contribution is basically to molecular and biological sensors, mostly specific for medical diagnostics. As we don't have too much time, I will skip some of the slides, but I think most of you know, but just very briefly where we are. We are located in Salzburg. We're founded out of Sony ADC Biosciences as a division, and been under the umbrella of the Stratec consortium since 2016, but we are still kind of operating independent here, manufacturing polymer-based consumables for biomedical application and mostly medical diagnostic here. Interestingly, or importantly for people we collaborate with, is that we don't have an own market access actually. We don't manufacture reagents and so on. We are focusing really on the consumables that serve as a platform for sensing devices, for microfluidics, for analytical procedures and assays of any kind that we usually co-develop with a partner. And the core technologies that we are focusing on are design and mastering activities, which means really creating those structures from scratch, making them into something, into a metal-coated material that can be used then for injection molding of polymers. Those injected molded polymers can then be coated afterwards, can be bonded to another piece, can be printed, can be loaded. And printing also includes, for instance, the printage of electrodes that then be used for different kind of diagnostic applications again. Of course, another big part from our company as well is the assembly, which is hopefully in ideal case as much automated as possible to ensure extremely high quantities and most in extreme high precision. And those technologies are focusing into groups that cover the mastering, as I mentioned before, molding procedures, bonding. And here the bonding is essential because of the alignment of certain structures that are needed to detect extremely rare or extremely rare events or very low signal strengths actually. Also coatings and certain content filling can improve or can allow the diagnostic and the sensing of certain particles or molecules in a body fluid. Collaboration with us is following usually a phase-gated process that is basically starting with initial phase where we start to know the project of each other. And as we are supplier only, this is extremely important that the people we collaborate with know what they need and what they actually want and what their goal is. So what do they really want to look at? Do they understand their assay and what's their scope on the long run? Then we create a feasibility phase where we test all the discussed aspects. And after the feasibility phase, we usually should know how the product, how the consumable should look like. And once we know that, we can go into so-called prototyping, pilot, and mass phases. And at the end of the day, a product should be available that really reliably performs for sensing usually ultra-rare molecules or ultra-rare events like single cells or single cancer cells in a complex cellular solution like blood. Just as a background from my side, I'm not raised in technology. Basically, I'm a cell biologist by training, and therefore I'm viewing the entire concept more from the side of an application, or basically from someone who is trying to use it or tries to answer a biological question with it, or also tries to sense certain happenings in a biological fluid, for instance. So, but what are sensors in biology? I mean, you're from the field, you're more the experts. But there is, I found a very nice definition about what a biosensor is actually. And it says a biosensor is an analytical device that detects changes in biological processes and converts them into an electrical signal. And that's the key. So no matter what you're looking at, it's always an observation, a certain target, signals coming up, and it's converted into electrical signal to be read out by the user until understood what's happening at the end. There are three main groups, mostly when it comes to biosensors. So the bioanalytic group with using enzymes, bioaffinity group that includes antibodies, nucleic acids like DNA-based sensors, and then also microbes containing sensors that are, for instance, used to determine the amount of heavy metals in drinking water, which is a pretty exciting project that I've been heard of recently. I just put a paper here that I think was published recently and kind of discusses the most prominent biological applications of sensors. But so why are they so relevant? So why is biosensing so relevant? It's the application is just extremely broad. As I mentioned before, you can use them as variable. You can use them in combination with microfluidics like we do. But also, on the other hand, you can use active molecules like enzymes to serve as your biosensor, or antibodies, DNA-based sensors. I mean, there's the broadness of the field is extremely wide, and the application, if applied properly, can cover a lot of questions in the medical field, but also, of course, in food manufacturing, agriculture, and environmental sensing. But still, the challenges are huge. And where is the field developing? I mean, you guys probably know that better than I do, but from an application point of view, the challenge is still remaining, saying what we need would be even higher precision, more sensitivity, but also more selectivity, and at the same time, more multiplexing. So basically, we need the egg-laying wool pig that allows the exact understanding and the sensing of the target that I am looking for. May it be a gas, may it be a rare molecule, or may it be a cell with a certain surface marker. But I think we are not there yet. So, sorry. So one part is that we are dealing with, and it's really just a small part, but I thought it might be interesting for the audience here, are plasmons. Plasmons, probably known by most of you, are basically, plasmon is a quantum of a plasma oscillation. A plasma oscillation consists of this, and it's basically described as a quasi-particle that is usually consistent of some kind of a metal. So mostly it's gold, it's silver, or platinum particles. They can be discrete. They have usually very optical, they have optical properties that are unique to their size, to their dimension, and to the material. And they are starting to be increasingly incorporated into commercial projects and technologies, as they can be serving as a completely different approach to making something that I'm interested in visible, and therefore, again, understanding it, collecting it into electrical signal, and then understanding the prevalence or the presence or the functionality of my target in a certain system, whatever it be. Also, again, here, just out of interest, I attached a paper on the bottom that I think is extremely interesting to read when it comes to details about those effects. As a matter of time, I will go through these slides pretty quickly, but the most interesting subpart of this for our projects that I present you in a minute are surface plasmons. Surface plasmons are the coherent and collective electron oscillators confined at the dielectrical metal interface. These are extremely interesting because what they can do is basically enhance light-matter interaction, but these light-matter interaction strongly depends and is related to the materials and the actual structure of the materials. So the choice that you use of material and the combination of materials that you use for developing your biosensor is extremely essential for the application and for the targeted reader that you have. And the application, as I mentioned before, as I'm coming from biology, for me, most interesting is, of course, fluorescence, because at the moment, literally, like most of the assays that are dealing with medical diagnostics are based on fluorescence readouts, but also Raman scattering, kind of heat generation, photoacoustic effects are coming up pretty quickly at the moment, and many others like photocatalysts, and of course also technologies that are used in solar energy conversion, less used in biomedical devices, but still those technologies are also coming up here. And I will skip those slides now, but I think that just to have it in mind for you is that they have a great effect, as I mentioned before, on fluorescence and excitation. And also Raman is an extremely interesting technology to detect molecules without actually staining them per se, and therefore creating a molecular fingerprint of the substance that you have. So may it be a histological cut, may it be a sample of blood, or may it be any other complex structure. Raman is really a powerful tool here, and the surface plasmones made from nanoparticles can actually serve as an enhancer of those. Many of you probably know the terms SERS and TERS, which are two subtypes of the Raman technology, extremely important and essential tools in biomedical diagnostic, and need still a lot of development and further innovation, because they have such a great potential, but still, even though we know a lot, it's not yet where to really elaborate the full potential. What Stratec can do is one of the key features of our company is to create micro and nanostructures. And micro and nanostructures are becoming, of course, more and more essential in biomedical and molecular diagnostics, as reduction of material, reduction of biomaterial that is available, and increase of precision of diagnostic is extremely essential. And of course, it also has to become faster. Everything is speeded up, and everything has to go down with respect to time and costs. So the two most typical approaches to detect a certain particle or protein of interest is either a metal-enhanced fluorescence-based assays, which is one technology that I will present you in a second, or MEF. And the other one is the famous enzyme-linked immunosorbent assay, or shortly ELISA. They both have their benefits or disadvantages. Both are extremely powerful sensing mechanisms, basically, but have different approaches when it comes to detection of your target, or of the device or the thing that you want to sense. To explain a little bit more, I will give you two short examples about products that have been realized that are on the market. As I mentioned before, we are mostly suppliers, so I would say 60 to 70% of our projects are actually confidential. And so we can only talk about freely about very few of them. But one that I'm really excited about is the project we have with Quanterix, and it's called CMOA, the project. Maybe some of you have heard about it. And it's a disk that serves ultra-rare molecule detection. The application of this disk is basically, or was originally, the analysis of neurofilaments. Neurofilaments are small compartments of neurons that are secreted usually into cerebrospinal fluid, but also to a very, very small extent into the blood, that would detect damage of neurons. And they are mostly important with respect to diagnose whether a person has damages in a central nervous system that could either lead to a neurodegenerative disease or to a defect like after sports or injury that has not been detected and can create big problems later on. But those proteins are extremely rare, and gathering liquid from the cerebrospinal area is extremely demanding for the patient and for the medical doctor. So what the challenge was here is, can we find those extremely rare molecules in the blood sample, which is easy to retrieve and can be repeated regularly. And what we were aiming for was developing a single molecule ELISA, basically. Just very briefly, for the matter of time, I won't go through the manufacturing process, which we can actually exchange easily if you're interested afterwards. And I can also help you to send you some background information on the project. But what you see on the right side is the key structure here. Those 3 micrometer diameter wells are used to capture beads that are artificially brought into the system to capture those extremely rare, up to single molecules in your blood sample. And the outcome were extremely spectacular. There were actually unexpected sensitivity levels reached that have not been estimated beforehand. We could also make this product fully automated. The precision is, to that date where it was developed, which was a few years ago, unmet. It has an extremely wide dynamic range. It's therefore extremely cost efficient and time efficient, and has, what I mentioned before, great multiplexing capabilities, and can also be modified by the applier and by the user actually. And this is sensitivity means knowing is, I think, one of the key points when it comes to biosensing. I just skipped something. Can you still see my screen? Because I cannot see it anymore.
Yes.
Okay,
you
because
can see this Simoa disk for
okay, now because I can't
site.
see it anymore, and I'm not sure what I did. I think I pressed something. No, I
You
can
see your cursor also now.
yeah, but I cannot see my my presentation anymore. I think something changed in the as you said, Teams has changed, so I don't know. I think I just see the people who are attending, but I don't see my screen anymore.
Maybe
could you just go to the next slide by pressing space or something like that?
I can only see the contributors. What is happening?
Maybe could you stop sharing and start again?
Maybe I try this. So sorry for that. I don't know what the problem is.
This is just Teams. This is not the.
Okay, now can you see it again?
Yes, we can see it.
Yeah, okay, perfect. Thanks. Sorry for the interruption. So that's basically the outcome of the project, and it's actually been a full. Our mother company developed the instrument for them. We developed the discs and use of consumables for that. And what you can see, which I thought was pretty impressive, is the sensitivity. So from the time of 3.5 attomolar of a molecule, we could see first detection, and also could quantify the amount of volume. And this, for that time point, which is about 2015, 2012, where it was developed, was an unmet sensitivity of detecting biomolecules. And I think that was a pretty big success story. They use the same tests now for quantifying COVID particles as well, which are also potentially super rare. So the entire setting was used for, or is set up for rapid COVID tests now, and be spread out of the world. And all of the tests are covering up for up to 20% of the worldwide done COVID tests, which is pretty fascinating, I think. Second example that I want to share, it goes to the other direction. This is how to create, as I mentioned before, enhanced signal with using nanometals as a support for biosensing. Just as a reminder, this system here it works, it's fully automated, but it's extremely complex as well. You need an own machine, you need a fully automated readout, you need a very, very complex consumable, which works if you have a large facility. But what if you say, okay, I'm a small laboratory, I don't want to go, and I cannot afford such a high ultrasensitivity reader for my assays? Then there was another approach. The nanometals or sulfur plasmons focus on the system on the left side, saying metal enhanced fluorescent based assays, which have a lot of benefits for many reasons that I show you now. The platform that was developed together with Diagnostics was published or is sold as a so-called FluoBolt product, and is actually based on on hexagonal arrays in nanometer dimensions and pit-like structures with extremely high aspect ratios. It's made on a COP, which is a polymer that has extremely nice optical properties, but on the other hand can also be blackened to also avoid light spreading out too much, and therefore also increasing the sensitivity. But the key was to sputter the surface of this plastic with a 40 nanometer silver alloy, which allowed the plasmonic effect. And the funny thing was, why we tried to make this in this way, is that it's actually compatible to any standard reader, any standard device that is actually out there, which has still a lot of compatibilities and possibilities. But now with this device, one can detect also extremely rare molecules using just a very normal microscope with a normal 96 well plate reader format. Again, I'm happy to share manufacturing details and processes and developmental steps on a separate occasion, because I think the time is running out. But just as you can see, that's how it usually works, is that we manufacture the most critical parts in stampers on a CD-based shape device, and then we dice those things out. The structures are made as well on the CD type base. We dice it out at the end and then fuse it together and implement it into this plate in this case. What is the application of this plate? Just to understand why it was so important to develop this extreme high sensitivity device for very broad application. Diagnostics developed this device beforehand for detection of biomarker in the picomole, however now even in the femtomole area. And the two most important proteins that they were looking at, they're usually falsified by additional staining. So when you stain them with a very complex system, or maybe or try to sense them in your high throughput reader, then very often those proteins degenerate or they're not very well detectable. But with this method, and also in the broader sense for research application, mostly it can be detected with using this normal 96 well blade in a very simple manner, comparably at least. And the two proteins that were of interest here were noggin and asparine. Both of them are relevant in bone metabolism, bone turnover, regeneration, and also have a very, very critical role in cancer development. So they were trying to be used as a marker for osteoporosis at the one hand, but at the other hand, different kind of bone tumors that are emerging mostly in young people, and they have been shown. Both of them have been shown to serve as a tumor inhibitory proteins, and therefore their activity is extremely essential. And the clinical relevance, therefore, is the detection of metastasis of osteosarcoma devices, and also the involvement and the formation of cancer, and their role in also, as I mentioned before, osteoarthritis, and therefore as a biomarker. Another clinically relevant factor is those two proteins also play essential roles in fracture repair once an injury occurred. And therefore, the measurements are essential, and they were used using a standard fluorescence microplate reader with a bottom configuration. It's extremely low cost, easy handling, and therefore it was really great to see those platforms being implemented in basic research laboratories as well. Just as a last slide, very brief advancements that happened recently, because those two examples that I showed you right now are already a few years old. So with collaboration partners and out of the literature, one can show that the ultrasensitive antibody aptamer plasmonic biosensors for malaria is now out published. So malaria is one of the diseases that is still killing the most people in the entire world. And therefore, detecting and analyzing and understanding malaria much better is extremely important for the global health system. And also and mostly finding a critical biomarker before disease is actually breaking out is essential. And here, this device can actually detect certain biomarkers in the blood of down to 1 picogram per milliliter blood. And also other plates are still coming up. There is now great new technology with using nano devices. It increases the sensitivity 11,000 times, and all kind of other systems. It's pretty exciting to see what's coming up, and we are happy to contribute to developments with microfluidic, microwells, and micropillar structures wherever we can. And for this, please let us know your challenges. This is always our thing. We always see our project as co-development. So there's many things usually when we start a project that none of us knows, none of the partner knows, but we are motivated and excited to start co-developments and collaborations with or even very challenging projects. And with this, I really want to thank you for your attention, and for all kinds of application projects, and also for general information. Please feel free to contact me. If you have a specific technological question when it comes to the materials or the implementation of processes and process management, my colleague Maximilian Pitzek would be the best person to talk to. With that, I want to thank you for your attention, and happy to get some questions.
Thank you, Magdalena, for a very interesting presentation, but unfortunately we don't have so much time for questions. So right. I would ask potential listeners who wants to ask to leave it maybe for later if we have a buffer. And now I would like to give floor to Karl Fritscher from Linet, who is presenting recent biosensing application and achievements in Linet. So Karl.
Hello, can you also already see my screen?
Yes, we can see it.
Perfect, thank you. Thanks. First, thank you very much for the invitation. I will try to catch up some time and make it short. Again, I think our topic or my topic here is quite different from the former speakers, but still I hope it's somewhat interesting to you. I will talk about recent biosensing applications achievements in Linnet. So first question is maybe what or who is Linnet? Linnet is the Linnet Group, let's say, is a company which is in general dealing with the production of beds for hospitals and nursing homes. There are basically two different companies, namely the Linnet company, which is located in Czech Republic, and Wisner Bosserhof, which are making up this group. So Linnet is more dealing with the creation of hospital beds, whereas Wisner Bosserhof is dealing with the creation of beds for nursing homes. Then there, of course, there are several other locations for support, service, and marketing and so on in different other countries. But a very new part of the company, or call it business unit, is the so-called Smart Care Austria, which has just been funded a couple of days ago, and where myself and a colleague of mine are now responsible to deal with smart care applications in the Linnet company. When I'm talking about smart care, I should probably define a bit more what we understand, what we mean with smart care. Smart care, as we see it, is the combination of digital and non-digital technologies, which are including hardware, in our case, of course, first and foremost beds, but also mattresses, and software solutions and services to, on the one hand, help the patients, increase the quality of patients, also, of course, help the caregivers, the nurses and doctors, and on the other hand, try to decrease the costs in nursing cares, nursing homes and hospitals. I would like to today focus on two different, let's say, groups of use cases, and then mainly focus on one product or one solution which we're offering, namely the SafeSense solution. Our focus groups, user groups, on the one hand, nurses and physicians, where we try, or whom we try to help to increase, as already mentioned, patient safety, meaning that we are focusing here on, let's say, three different main topics, which doesn't exclude others, but these are the main topics, namely zero falls of patients, zero pressure injuries, and patient deterioration. Zero falls means especially elder people often, or sometimes at least, tend to fall when they leave the bed, so they need some assistance when they get out of beds. Nonetheless, people try to do it without the help of others, then fall, are prone to break legs, which can then lead to further complications like pneumonia and things like this, and mainly also very severe complications. And we would try to help to reduce those falls and increase patient safety and help the nurses. Same with zero pressure injuries. Here also some patients with severe trauma, or also elder patients, tend to not being able to move when they are in their beds, which means to so-called pressure injuries, meaning that their tissue underneath the skin is damaged, which can again lead to severe complications. And this is one other topic. The third topic is patient deterioration, meaning we would like to see when patient, or to realize when the patient in advance, at an early stage, when the vital parameters like breathing or pulse of a patient are changing, or for example, the pulse is increasing for different reasons, or the breathing frequency is going down for different reasons. And these are events which we would like to notice, and then use these events and the signals behind it in order to make early predictions on potential problems which might occur in the future, or at least inform the nurses and doctors about these important events. The second is SafeTPort, which is not a medical product. SafeSense is a medical product. I will come back to this later. And SafeTPort, which will not be the main focus today. Just a few words concerning SafeTPort. This is a software which is mainly using the sensors coming from the bed, or integrated in the bed, up to 40 sensors, and distributes these sensors in a common language in so-called HL7, which is commonly used in hospital environments, and distributes these data to on the one hand to third-party software, but also to our own dashboards, and enables the personnel, the nurses again, to see different parameters of the bed. Also here, if the patient is in bed or not in bed, if the bed is tilted in a certain angle, and things like this. Today, however, as explained, I would like to focus on SafeSense, the SafeSense product and the technology behind it. I before mentioned this zero patient falls problem and problem which we would like to tackle. And here you see that in order to reduce the falls for patients, there is a large number of different sensors on the one hand, but also software products and hardware entities on the other hand, which have to be combined in a certain way, which have to be connected, which have to communicate and interact with each other. And on the one hand, it's the bed, it's the mattress. On the other hand, it's devices for room monitoring, for example, where you can see if the patient fell when he left the bed, for example. On the other hand, you need mobile applications in order to display the values of the patients. I will come back to this in a minute. You need software or integrate with software in the hospital, where you would like to export the values that you gathered from the patient inside the bed. And of course, you need the sensor device that is gathering these sensor values of the patients, certain values of the patients, vitals, vital data, for example, pulse and breathing, which I will deal with, or which I will explain in a few minutes. And all these devices need to talk to each other and need to be connected. So connectivity is, of course, one big thing and one big topic and one important topic. And the second thing is, sensors and signal analysis and signal processing on the other hand. Firstly, one word concerning the connectivity topic, or let's say the SafeSense platform in general, which is dealing with this connectivity topic in general. This SafeSense system consists of different parts, namely, first of all, of some sensor, which I will come to in a second, which is integrated in the bed, in different types of bed, nursing home beds, but also hospital beds. On the other hand, we have the mobile devices, where all those data from the beds are sent to on the one hand, mobile devices, on the other hand, but also on the other hand, also ward PCs, where have an overview over the patient or over all patients and see the current values, see the history of the values in order to being able to see changes of certain parameters of the patients and to act accordingly. Currently, the current product of the SafeSense platform, or in the first step, we are focusing on some of the parts or the topics I've already mentioned: pressure ulcer prevention, fall prevention, and in general, patient safety. So a bit more details on how we are going to do this, or how we would like to help the personnel doing this. Here you see this dashboard that I was mentioning before, where in each of these lines you see one patient, or each of these lines is representing one patient. On the other hand, you see those colored tiles, which hopefully remind you of traffic lights, because that's what they're meant to be, more or less. And where all the green tiles indicate that with this patient everything is okay, at least concerning, in this case, concerning the activity in bed, movements, and concerning the bed status, so if they're inside the bed or outside the bed. So this first column determines how long the patient did not move. And if patients do not move significantly for a certain amount of time, this tile turns to yellow and indicates it's getting, the patient should, or soon the patient should be actively mobilized because he is not moving enough, and in order to avoid pressure ulcer, this person should be actively or should be assisted in changing the posture. At some point, for example, when the patient is leaving the bed, but also when this time exceeds a certain limit, the nurses are getting notifications, so kind of alerts which are forwarded and visualized in these dashboards. There are also acoustic signals, of course, and there is also a connection to the so-called nurse call system, which is this, for all of you who have been in the hospital, this button you press if you need the nurse. Then the nurse is coming to your room and helps you with certain things. It's the same system that we are using in order to notify the nurses and tell them that they should help the patient because something is happening which shouldn't happen, or at least which the nurses have configured the system for to get these alerts. So this is the dashboard, the software part. And then we're coming to the sensor part and to the hardware part before we then have a look at the signals themselves. So the sensor for this what I have shown up to now, movement and basically movement monitoring, is this form-filled pad. It's electronics free. It's just really foam and air filled. It's located underneath the mattress. Here it can be placed in the chest area or further below in the pelvic area. And this sensor pad is connected with an air hose to this sensor hub, which is basically containing a differential pressure sensor, which is monitoring nothing else than changes of the airflow in this air hose. And you can imagine if somebody is pressing on this mattress and is applying pressure on it, then this air-filled pad or foam-filled pad gets compressed. The air here gets moved, and this differential pressure sensor is sensing this movement. And based on this airflow or these changes in airflow, we detect these movements, and we can detect if a patient is in bed or if he's outside the bed, and so on. In the first step, some more steps than later on. So let's have a look at these signals. They don't look really spectacular in this case. This is a signal of over 3.5 hours. And you see those more or less chaotic spikes here, these larger spikes and smaller spikes, and these complexes at the end. These larger spikes are just indicating those larger movements. So when the patient is moving and the patient is turning to the side, then he is creating some specific signal pattern, which we then, or this sensor box, which is located in the bed, can use to classify this movement, so that it can classify it into is it a minor movement or is it a larger movement, and does this movement help to reduce the pressure ulcer, or is it just some arbitrary movement of the hand, for example, which would not be helpful in terms of reducing the risk of pressure ulcers. So these are those larger movements, these are smaller movements, and the bed exit signal, or the signal when the patient leaves the bed, is again differently with a different signal shape and can then be detected. So this is basically the detection of movements and bed exit, which is not really spectacular, one could say, because it's large pressure and releasing pressure and applying pressure on the pad. The maybe more interesting part, at least from a signal analysis perspective, is the remaining part of this 3.5 hours, which more or less looks like noise here. But when moving further into this signal, and you will see this in the next slide, you will see that it's not at all noise, but that it's some periodic signal, and it basically shows you the movement of the lungs, so the breathing pattern and the breathing frequency, and also the movement of the heart. And I mentioned before this sensor pad, which is located under the mattress, and that it can detect pressure changes. And of course, it can detect pressure changes like when the patient is moving or when the patient is sitting in bed or leaving the bed. But it is the sensor system itself is so sensitive that it also can detect the vibrations of the body, which occur when only the heart is beating, for example. And all of you who have been lying in bed or sitting still might have sensed already that they feel those small vibrations when the heart is beating. And exactly these vibrations are also measured by this system, sensor system, which is located underneath the mattress. So this is this technology or this signal is called, or this method is called ballistocardiography. In the case of cardiac movement detection, and it measures on the one hand it measures the movement of the heart, and not like ECG, which you see here, the electrical stimulation of the heart, but really the movement pattern. So let's look at it in more detail. This is the zoomed signal you saw before, and you see here those larger peaks, which are the breathing patterns, and you see the smaller peaks, which are the movements or the signal that is caused by the beating heart. So each of these complexes is showing you one heartbeat. And so this part of the signal can then be used to access to get the pulse frequency, and of course to detect changes in the pulse frequency, which can indicate some health problems, might be infections, might be some cardiac problems, and so on. So on the left here you see those raw signals as we get them from the sensor, and on the right you see some filtered signals, and here in blue the mean shape of the signal, which is similar to a typical ECG signal, representing this typical BCG signal, ballistocardiographic signal, with different peaks and spikes, which are representing different movements of the heart. And in order to detect the pulse frequency, we made a study with 60 patients in the University Clinic of Innsbruck, and together with the University Innsbruck and the Healthcare University here in Haus, the UMed. And in the first step, we used some.
I'm sorry, Karl. I have to ask you to finish in 1 or 2 minutes, because there are other speakers waiting and which have to leave already.
Yeah, I understand.
Please, I'm sorry for that.
No, sure, but I started later already, but I understand. So I will come to the end. So this is the classic signal processing which we did, where we detected some peaks, and we compared to ECG, we achieved an accuracy of plus minus, or an average error of 4 beats per minute, which is absolutely acceptable, because it's absolutely sufficient for each doctor for these purposes. The second thing is, the second part was based on using a deep learning approach. We used different deep learning models, and it turned out that we could significantly improve the accuracy. You see here this average, this 4, which was the best result for this classic approach. And you see here the results for the deep learning approaches, and also here on the right. So the best was plus minus 2 beats per minute. And the good thing is that here you see the number of parameters. Those deep learning models sometimes have a large number of parameters, but also with a very low number of parameters for specific deep learning models, we achieved a very good accuracy of 2.3, or average error of 2.3. I will skip this one, just as an outlook. In the future, apart from pulse and breathing, we will focus on the shape of these signals in order to assess cardiac diseases and diagnose cardiac diseases, and on the other hand also blood pressure assessment, which also changing blood pressure has an influence on the shape of these BCG signal complexes, and so we can also detect changes in blood pressure. Right. That's it for me. Thanks for your attention, and sorry for the small delay.
No, I have to say sorry because I'm not moderating it very well, because all those presentations are very interesting. I wanted to see all the details, but we are already 20 minutes behind the schedule, so I want to also skip the break if you agree. The next speaker, based on the original agenda, should be Hanna Lísalová. Hanna, can you hear us?
Yes.
I would like to ask you for something, because Max Zonleiter, which is coming after you, needs to leave earlier. Would it be okay for you if he is starting now and you are after him?
Yeah, it's no problem for me.
That we swap those two presentations.
Okay, it's no problem.
Thank you very much.
Thanks a lot.
Yeah, welcome.
So Max, can you start immediately, please?
Absolutely. Yeah, sure.
So I want to introduce the topic of the presentation. Biosensing to enable multiplex COVID-19 testing and the point of care will be presented by Max Zonleitner, CEO at GenSpeed Biotech. So Max, the floor is yours.
Thanks a lot, and thanks for understanding. Thanks for the invitation, and I want to briefly show you a little bit what we are doing at GenSpeed Biotech. And we are using biosensing in many applications, but I want to share with you some things that we developed for COVID-19 testing. And this is multiplex detection of different things, and especially antibodies. So I'm going to start with a brief introduction. As you can see, we are a spin out of Griner Bio1, so we were founded in 2016. We are still we've rented some space there, so we're still in the building of Griner Bio1 in Rheinbach, Austria, and we are focused on development, production, distribution of rapid tests for really different applications. And the basis is always our GenSpeed platform technology that is patented worldwide and gives a lot of opportunities. So we started with the whole development in 2009, and we have different application areas. One of which is Oem Technology. So you can license our technology if you, for example, have an ELISA test that runs in the lab and takes 2 to 4 hours, and you want to have it done in 20 minutes at the point of care with the same quality, then you can we can transfer it for you onto the GenSpeed system, as you will see. So we have then, of course, thought of how we can have a contribution to defend pandemic. And there we started to develop a COVID-19 test, which I will show you in detail. We have some chairside tests for the fast detection of the key pathogens in periodontitis, which you can run directly at the dentist's office, only takes you 17 minutes. And then we have some tests for detection of hospital-acquired infections, which is not our key focus right now. So our system is composed of a microfluidic test chip that goes into our device, and the device is connected to a tablet via USB, and then on the tablet you've got the software that guides you through the whole workflow, and then in the end you get a result. So the test chip is pretty simple. It's a microfluidic device with an inlet and a reaction channel, which is of course core. And then we've got a waste reservoir. It's simple, but it's still, I would say it's really smart, because everything that goes into the inlet is sucked through the channel into the waste reservoir. You've got the advantage with the microfluidics that you have shear force driven hybridization reactions, which are much faster, of course, than if you have diffusion-based hybridization in an ELISA, for example. And therefore we can do multiplexing. So that's the real advantage of the system. At the moment, we can do 8 times multiplexing, meaning that you can detect or quantify up to 8 parameters in one run. We have also now applied for patent where you can double that number, so you be able to quantify up to 20 parameters in parallel on one chip. And what's also important, the waste reservoir is not just for the waste, but it's also the capillary pump. So by defining the design or the architecture of the waste reservoir, you can control the velocity of the fluid flow in the channel, which is also very important. So there's an animation that quickly shows you how this runs. So it's really easy. You've got a short turnaround time. In this case, multiplexing up to 8 parameters. We can quantify. Big advantage, of course, over strip tests, and we can use it for different applications. If you run the test, you insert your test chip. Then, depending on the assay, you've got a 5 seconds preparation of the chip. Then you add your sample, usually not with a pipette, but with other means, drop a bottle or anything else. And then just to show you, this is really a multiplexed microelyser. So we zoom into one of the test stripes, and then you've got your antibodies printed there. So this could be a COVID-19 antigen test. So we, if there is antigens, virus antigens in the sample, then they will bind there. Then we add, everything else is done automatically in the system. We add sandwich antibodies, which are biotinylated. And of course, there's unspecific binding in the channel and specific on the strip. Then we add washing solution. So all the ELISA system fluids that you would need are injected automatically. Then we add chemiluminescent substrate and we detect the localized signals and do data analysis, and then we get a result which is displayed on the screen of the tablet. We can quantify, you can really measure concentrations, or you can have yes, no answers depending on the assay needs. Everything is possible. So what is unique? It's really the combination that we are using. So it's this accelerated hybridization using this microfluidics. You get shear force driven hybridization much faster than in an ELISA plate. We also use chemiluminescence based optical detection that gives you the advantage of increased signal to noise ratios, and everything is automated, as you will see, for example, for the COVID-19 test. So in principle, we get fast results because it's rapid point of care. We can use, and that's important, we can detect proteins, so we can do ELISA measurements, but also RNA or DNA based assays. That's also very important. We have a high sensitivity, so we can go down to picograms per mil. That's comparable to ELISA assays in the lab, and everything is IVD-CE certified. So we have 7 IVD-CE certified products on the market already. And so it's a rather sophisticated technology already. So in this case, I want to show you something about the protein microelysers. So this is what we call a direct assay. And this is done in 15 to 20 minutes, and you get pico to nanograms per ml sensitivities. The slide also says RNA-based assays are possible. So there, for example, we have a product on the market that allows you to detect the key pathogens in periodontitis within 20 minutes at the doctor's office. And there we are directly measuring the pathogen's RNA. So this is also possible. We have tested with regards to our, what we call a microelyser. It's a multiplexed microelyser. We have tested very different formats, so a direct ELISA, indirect ELISAs. What's nice about the system is you can even compose a test that combines competitive ELISA with a sandwich ELISA, and by that, so we call it the chain speed tool set. By that, we can increase the dynamic range of the whole system specific for the customer needs or for our test needs. And this, what I want to share with you is a typical layout of our tests. For example, in this case, this is a cardiac disease marker chip where we detect in parallel D-dimer and high sensitive C-reactive protein, which would give you a good guess about the chronic cancer, not cancer, sorry, the cardiac level or health of the patient. And of course, we add some controls, but this was our first benchmark test to show that we can quantify two parameters in parallel. I skipped that movie. I'll show you test movie anyway, I think, afterwards. So what you see here is that we can really measure the concentration of 2 different parameters. So in blue, you see the C-reactive protein, which is a competitive ELISA in this case, and the other one is the D-dimer, and we can measure that with a good quantification. And the dashed line here is the control. Then we did some measurements for PCT just to show that usually if you have a standard lateral flow strip test, you will never get 20 picograms per ml sensitivity. So we can really go down to the picograms per ml. If you compare it to other systems, of course, there are all these lateral flow strip tests. We all know them. And they have disadvantages, of course. They are fast and easy to use, but of course, there is a lower sensitivity. Multiplexing is not really possible. Also, quantification is a problem often. and analyzes the other way. It's for analyzer in the lab, it's the other way around. So you get high sensitivity and specificity, but it's complex. It takes you 2 to 4 hours, and of course, the instrumentation is cost intense and no random access testing possible. And with Chainspeed, we combine the best things of the two worlds, more or less, and that means fast with good quality and multiplexing also possible. So this is now the COVID-19 IgG Xbox antibody test that we developed starting in April last year. So this is the test kit box that you get. There are the test chips in there. There is the reagents container that goes into the device once. So you insert that, and then you can measure 25 test chips. There's also the analytics tools that you need. And this is how it works. So multiplexing is really key for this application, and probably you know already that we have the virus particle, we have the spike protein. On the spike protein, we have the receptor binding domain. And you've got, so if you've got antibodies against this domain here in the spike protein, you have neutralization antibodies or neutralizing antibodies, sorry. And if you have had the disease, you could also develop antibodies that that bind to the nucleoprotein, which are not neutralizing. And we've got a 3-plex on this chip. So that means we detect antibodies against the receptor binding domain, antibodies against the nucleoprotein, and antibodies against the spike protein. And we can, by that, differentiate if someone was, for example, vaccinated, if he's got neutralizing antibodies, or if someone, for example, had the disease, then some of them will only develop nucleoproteins. Most of them will develop both. But if you're vaccinated with the current vaccines that are available, you will only develop antibodies against the spike and the RBD. Yeah, and then we did a publication, so I skipped that one. So we published that in autumn in the Journal of Clinical Virology, and our partner, the Medical University in Linz, compared our test, the point of care test, with the ELISA tests in the lab. And if you look at that, so it was around 120 samples that were measured. And if you look at the sensitivity and the specificity, so we compared to the lab ELISAs that take 2 to 4 hours, then we got great results. So we are, if you look at both sensitivity and specificity, then we are 3rd out of 7. And that was great. And now, of course, you know, the vaccination, there is now also a need for detecting neutralizing antibodies. And this is how our result sheet looks at the moment. So you will get results for if you've got antibodies against the spike RBD. So this would be the neutralizing antibodies. And this is a sample that was taken from a vaccinated person. And you can see that he's got a high level of antibodies, and there is now the standardized range. It's a WHO standard that now allows to, let's say, compare the different ELISA systems or different antibody test systems with regards to the units. This is binding antibody units per ml. And you can see there is a high protection. And I think there is a new Nature Medicine publication that tells that if you have by a concentration higher than around 13 binding antibody units per ml, then you have a 50% protection against new infection with SARS-CoV-2. So that means, in summary, we can predict more or less the level of protection after disease or vaccination. We can discriminate between infection and vaccination. And now we got also the binding antibody units. So this is a standardized result that you get from our test. If you look at that, then you would need to run 3 ELISAs in the lab to get the same quality of results that we get with our point of care solution. And that's what we compared our test now with the Viennese, let's say, company or lab, big lab. And we have shown that we have more than 95% agreement with the measurements, and they use both big ELISAs from Roche and Diasorin, and so you can do the same in 20 minutes on our system. So that was fast, and thanks for your attention. And there are some questions, one or two. Thank you.
Thank you very much, Max, for your presentation. Since Max is leaving soon, is there any immediate question? A short question, short answer? So then, Max, thank you for your presentation. There are no questions, and we are a bit behind the schedule, so I would continue with the next presentation, if you don't mind.
Thanks a lot.
Thank you very much.
Thanks again for your understanding.